The first of the studies is the PRIMUS001 study, which, although this will be for all comers and in simple terms is relatively modest in what it's doing clinically, it's really looking at doublet chemotherapy with gemcitabine and Abraxane versus triplet chemotherapy of 5-FU-oxaliplatin and Abraxane. What we're actually wanting to do is to have real-time genomic sequencing of these patients, because what we're seeing from the work that was done in the Nature papers, Nicola Waddell and Peter Bailey, is we are seeing that about a quarter of patients with pancreatic adenocarcinoma will have a DNA damage repair deficit. Almost, people may think this is almost like, you may have heard of the BRCA mutation in breast cancer. We're not talking about full BRCA mutations in the form of inherited genomic aberrations, but really a sort of BRCA-ness, essentially. What our premise is, and what our understanding from early research and from small studies that have been done so far, is that 25% of patients with a DNA damage repair should respond far better to both platinum-based chemotherapy and, actually interestingly, particularly in the localized cancers, radiotherapy as well. So that's where we are, and the PRIMUS001 study is now fully through ethics, and in fact, I'm pleased to say is about to start recruiting in Glasgow before the end of the year.